Hi, good morning, everyone. Hopefully you guys had a nice weekend, a nice relaxing weekend for our long weekend break with Memorial Day. Hopefully you guys remember the reason why we have Memorial Day. Um, so this is our Unit 4 discussion. Instrument and equipment sterilization is what we're going to be talking about today. These are some big chapters, I guess you could say. A lot of information packed into this, okay? So if you need to revisit this later down the road, or if you need to like pause it and try to like soak it all in, that I definitely would recommend that because there's a lot of like little details that are going to be super important to your job in this entire unit, really. Okay, so our objectives are going to be basically talking about the standards and best practices again on the types of sterilization that we're going to be using in the sterile processing department. Again, we'll kind of relate it back to aseptic technique, sterile technique, and how each facility uses different things. We're going to demonstrate proper processes and mechanisms, so that kind of goes back to your instructions for use. And then, as always, we're going to apply our med-term and basic anatomy as we talk about those topics. All right, so here are your assignments for Unit 4. You guys are doing really well so far and keeping up with everything, even though it's a fast-paced program. Make sure you are getting in your discussion. I still see a few of you kind of lagging behind or forgetting maybe to go back and post to two of your peers. You need to make sure you do that for full credit. That takes off several points if you don't go back and respond to your peers. And notice this big guy right here, okay? Material safety data sheet research paper. So plan accordingly, okay? Because that's 90 points and it is weighted differently. So it's not going to be in the same weighted points category as it is in like your discussion posts or your realize it modules. It's in a different category. So if you don't do that and you take a 0, it's going to drop you significantly, excuse me, into a non-passing grade. Okay, so be aware of that and manage your time accordingly so you can get that turned in on time, right? Let's see here. So let's get into our discussion here. Point of use processing is what we're going to first start talking about. So why is it important for central service technicians to stay up to date on best practices? So this is true of any job. Why do you have to stay up to date on best practices? Whether you're in central services, you're a surge tech, surgeons, nurses, whoever. It's always important to stay up to date because industry standards change regularly because especially in the healthcare field, there's constant research on how can we do things better? Is what we're doing enough? Sometimes is the question. So we want to maintain quality assurance for our patients in every step of the way, whether it's, decontaminating instruments, whether it's, how do we handle the instruments at the point of use when they're being used versus how do we sterilize them? How does it affect sterilization? So a good example here is flash sterilization versus something now called immediate use steam sterilization, IUSS. These, back in the day, I'll just show you my age. When I first started many years ago, we would call it flash sterilization. Now they no longer like to use that term because it implies that it just has a different implication, and we've changed when we can use flash sterilization versus immediate use. It's kind of the same concept, the same machine, the same process, but we have to go about it differently because people were overusing this flash sterilizer to just put something in because they didn't want to wait for the full process, the correct, go back down to decontam and the whole reprocessing, cycle instead of just, you know, throwing it in that steam sterilizer. So they were coming up with like, surgical site infections and stuff like that. So they did a lot of research on, what would be appropriate to use for that immediate use steam sterilizer. So that is one example of how the industry has changed. There are a lot of them, okay? And even your IFUs will change instructions for use sometimes. The company may say, okay, this is a better way of doing this. We found something more efficient. So staying up to date with that, even staying up to date with your, we call them CEUs. They're continuing education units or credits. If you are sterile, or if you're not sterile, if you're certified, if you become a certified sterile processing tech or surge tech, whatever you end up going for, you are responsible for maintaining your education, staying up to date on those best practices, because that's kind of the point of certification. It shows that you're willing to go that extra mile and that you are going to maintain that level of education that is needed to stay up to date in your best practices. All right, so let's get into some of these. What are the standards and recommended practices for IUSS? So remember, IUSS was that immediate use steam sterilization. So obviously, it's in the word, it's needed for immediate use, right? Okay, so it's an instrument, let's say that you drop the only hemostat, which wouldn't happen, the only hemostat in your department, and you need it right now. The surgeon has to have it to complete the surgery. Otherwise, there's going to be a bad outcome for the patient. Then it is appropriate to use the immediate use steam sterilizer. Okay. You can't just use it in between cases because you don't want to wait for the time that it takes to re-sterilize it the proper way. The different instruments will be sterilized or IUSS differently. For example, a lumen has to be brushed and flushed. It's a fun rhyme. Versus like a hemostat, there's obviously nothing there to flush, and it will have a different time cycle as well because of the lumen versus a non-lumen. Manufacturer cycle times are followed. Usually they're posted right there next to your machine. At least in our department it was. And then transport in a way to prevent contamination. So, if you dropped that dirty hemostat in the middle of the case, but you need it back, you have to process it or transport it to that machine in a way that isn't going to contaminate everything else as you're, walking through the facility. You would have to contain it. Okay, so you'll see this abbreviation AAMI pretty often. You've probably noticed it throughout the book. This stands for the Association for the Advancement of Medical Instrumentation. So they're kind of the industry standard. They set the standards for how things should be sterilized or processed. So most facilities are going to reference and follow their guidelines. Okay, so what about the Joint Commission? Have you heard of the Joint Commission? It used to be called JCO. So if you are ever at a facility and they're saying, oh no, JCO is coming, everybody run. It's the Joint Commission. They've just kind of changed their name. But the Joint Commission, as a group, is responsible for accrediting all healthcare facilities. So if you're going to a hospital that is not accredited, it means that they have not met the minimum level of standards that they should be giving to their patients. So I would run far away from a hospital that is not accredited by JCO, Joint Commission. Okay, so what do they say about sterilization? They affect every step or every aspect of a facility. So if the items aren't cleaned properly, they can't be sterilized. So they're saying that you have to make sure it is properly cleaned and decontaminated before you sterilize it, which makes sense, right? If you have that bloody hemostat that you didn't rinse off and brush off all the blood and you just throw it in the sterilizer, it's still not going to be sterile. It has living tissue on it. Living tissue cannot be sterilized. That's important, okay? So we have to remove all that living tissue. That living tissue is called bioburden. We have to get rid of that before we sterilize it. The Joint Commission also makes you document anything you've used for point of use processing, your IUSS. So if you put it in that steam sterilizer, there will be a log that you have to fill out to go with that. And it's for traceability. So if something comes back that machine maybe failed the load or it didn't complete the load, something happened and it didn't process properly, they have that trace that you could follow to that patient. So if the other way, if the patient got an SSI, surgical site infection, they could kind of go back and do like a little investigation to see what maybe have happened throughout the case. Always follow IFUs. And lack of instrumentation is not an excuse, okay? just like being impatient is not an excuse for using your immediate use steam sterilizer. Just because you don't have um, an instrument, that doesn't mean you just can throw it in that machine and have it back quicker than going through the correct process, because you, especially as a sterile processing tech, have to plan for those things. You have to plan ahead, like, okay, we only have one of this special instrument and this surgeon has three of these cases. What they're going to have to do is probably spread out those cases. Maybe put something in between them, especially if the surgeon has other cases. You can, throw something in there to give you guys enough time to sterilize that instrument properly and have it back the correct way for the next patient. All right, so here's where it gets kind of like it's a lot of information, okay? It's a lot to memorize. My students always tend to struggle with these just because it's a lot of numbers, it's a lot of different things. So um, I would maybe like do whatever you can to write this down, make note cards out of it. This is something you're going to have to memorize, not just for your certification exam or a test, but for your job, okay? And once you start to do it, you get in that facility and you're just doing it, you'll probably memorize it a little bit better. But there's different types of sterilizers here in the first column. And it matters what the instrument or the load configuration is, because that affects especially the time. The temperature in these types of steam sterilizers or IUSS cycles are all the same temperature, but when you get into other sterilizers, they start to change. Okay, so this is for your IUSS cycles, immediate use steam sterilizers. So there are basically three different types of IUSSs: gravity displacement, a pre-vacuum steam sterilizer, and the steam flushed pressure pulse. I think in my facility it was a pre-vacuum. That was pretty common. These top two are very common. So load configuration, notice as non-porous items. So porous means like it has holes in them, no lumens, okay? Um, so non-porous or porous sterilized together, like with a lumen or plastic or rubber, those are kind of porous items. You have to up the time to make sure it gets into those spaces efficiently there. So 270 degrees Fahrenheit in either 3 or 10 minutes. Now, if you're pre-vacuum, notice the second one here with the lumen is only 4 minutes. So gravity displacement is longer. Pre-vacuum can be 3 to 4 minutes. Okay. And then same here with your steam flushed, non-porous or mixed, it didn't matter, 4 minutes. Okay. So still talking about your immediate use steam sterilizer, some quality control measures, okay? When you're running those loads, you have to put in your indicators and your monitors. So remember, your chemical indicator is that usually it's like a strip of paper that will change colors if the conditions for sterility were met, okay? You'll also run a biological indicator or biological monitor. So remember, the difference there is the chemical indicator just tells you that the conditions were met for sterilization. But the only true way to tell if something is sterile or can be considered sterile is a biological monitor. So it's usually like a little vial or something that contains, and we'll get into those in a minute, a type of bacteria, a spore-forming bacteria that is hard to kill in that load. You want it in that load. So then, depending on the type of monitor, it can be read in a couple hours if it's rapid, or 24 hours. And you'll check that monitor to see if any bacteria grew. Now, if it grew, obviously that load did not sterilize it. That's the whole point. If it killed that vial of spore-forming bacteria, then you can consider whatever was in that load to be sterile. Okay, and that's true of your sterilizers down in central as well, not just IUSSs. You're also going to have a dynamic air removal test done daily. Okay, so this is also known as the DART test, D-A-R-T, dynamic or daily air removal test. Okay, that makes sure that the air is being sucked out as a part of that sterilization process. We talked about the traceability. You'll also include things like the patient ID, the sterilizer number or ID, what was being sterilized, the parameters, why it was ran. So they're getting pretty detailed if they ever have to go back and trace something, and then who ran the load. So you are attached to it. Okay, so now let's get into some high temperature sterilization. Let's move away from IUSS for a few. High temperature sterilization is only good for items that obviously can withstand high temperature, usually dry heat, or it could be with steam, a high steam temperature. It is super effective. This is a great sterilization method, and it is one of the most frequently used methods. Okay. It and since it's a sterilizer, it's going to kill all microbes, including spores. That's what sterilization means, right? So dry heat isn't often used. Steam is going to be more common, your steam sterilizers. Okay, so let's specifically talk about those steam sterilizers. They are low cost. They're very efficient, simple technology, so that's really why they're probably most commonly used. They're great for departments if they're low cost and simple, right? The cycles to run a load is relatively quick, and it doesn't have any like harmful chemicals. Some of these others we're going to talk about have harmful, toxic, even carcinogenic chemicals used on the instruments um, that could be harmful to you if you become exposed to those. So what is in a steam sterilizer? Let's look at the components. There are three main parts to the steam sterilizer. Okay, first you have the jacket, then a door gasket and chamber drain, and then the gauges and controls. So the jacket is the outer part. Okay, it is insulated. That's everything else is inside of it basically. It's where you'll put the instruments inside the jacket. The door gasket is on the front. That's what you open and close. It is sealed around the edges. When you shut it, it has a nice tight seal. And the drain, this is important, is usually near the front or center of the floor. So any steam or water would go down that drain. Gauges and controls, you obviously have to monitor what's happening inside. This is how you make sure you know parameters for sterilization were met. Remember that temperature will be on there, so pressure is going to be listed, and a time, okay? So different types of steam sterilizers. So we already talked about the IUSS, but look at all these others, okay? There's your good old-fashioned tabletop. It's usually smaller because notice this one's going to be for like clinics, offices, maybe even like tattoo shops would have something like this to sterilize their equipment. You have a gravity air displacement. So it basically means that air is heavier than steam and it's going to use that to its advantage to help sterilize instruments. The dynamic air removal is similar to gravity, but it's going to literally have a vacuum that sucks out the air, and its temperature will be slightly higher than the gravity. This pre-vacuum is pretty common. Okay, this is one that you have to have that DART test. Remember the daily air removal or dynamic air removal test? A commercial name for that, the DART test, is a Bowie Dick. That's just a commercial brand name for that test. So don't get that confused. It has to be run daily though on every pre-vacuum. Steam flush pressure pulse, we had mentioned that as being like an IUSS option. It says it repeats a steam flush and pressure pulse to remove the air, to suck all that air out. We talked about IUSS. Notice it says here at the bottom, saturated steam is required for all steam sterilization. Right here, all of these has to have some sort of saturated steam in there. And so steam temperature is increased with pressure. So you have to have an adequate pressure being placed on that steam to become effective. All right, so what are the phases of the steam sterilizer? So you first have a conditioning phase, then an exposure, exhaust, and most of the steam sterilizers do have a drying time because you don't want wet packs, right? So conditions for sterilization can only be met when these parameters have been met for each type of sterilizer. So it does vary per sterilizer. Some of those might have a different exposure time, like we talked about with the lumens, etc. So they have to be very specific in their parameters. All right, so it's also important to know how to load a steam sterilizer because you can't just throw things in there and hope for the best, right? Unfortunately. So to do that, you have to make sure or the whole purpose, I should say, is to make sure that every surface of everything that you load in there is coming in contact with the steam. That way it will obviously become sterilized. So here are some just little tidbits, notes that you need to keep in mind when you're loading a steam sterilizer. You want to avoid overloading. It's going to limit where the steam can move if you shove it too tight, okay? Packaging must be appropriate for steam sterilizers. So you talk about like the wrapping, usually it's the blue wrapping around instruments, the muslin wrappers, has to be appropriate for that type of sterilizer. So it could be a different wrapper for an ETO sterilizer. Be very careful with what you're wrapping. So this goes with this overloading. Visible space between packs, what you have loaded in there. Okay. Place the hard goods on the bottom to prevent condensation from dripping. You don't want it dripping down onto something else. Packages cannot touch chamber walls. So it goes kind of back to overloading, and make sure you're very careful with how they're set in there. This is important. Basins are set so that they're on their side to promote drainage. If you have like a bowl or a basin sitting just normally, the condensation would pool inside that basin and it wouldn't dry efficiently, so it would not be sterilized. And then stand up paper or plastic peel pouches using a basket or rack, so they're like vertical, not just stacked on top of each other. All right, so go ahead, keeping those things in mind that we just talked about, you could end up with wet packs from your steam sterilizer. So what are some common causes of that wet pack? First, you want to troubleshoot with the most common errors. Going back to the things that we just talked about, they're not loaded properly. So that could be a simple solution. Troubleshoot, okay? Maybe your instrument sets are too heavy. There is a limit to how much you can put in an instrument set. I think 25 pounds is usually the max. Not using absorbent material between heavy things like basins. Things are wrapped too tightly, which wouldn't allow the condensation to escape during the drying time. Items are wrapped while still moist. That's a common one too. You gotta be careful everything's dry. Cups or basins are not on their side. They're sitting the incorrect way. So just look at some of these are going to be I think as you kind of work your way down these boxes, these are going to be the least common. So start up here when you're trying to troubleshoot. You're loading your instrument sets, make sure you pick the right textile, as opposed to something is broken. Okay, not saying it can't happen, it obviously can, but start with the easiest, most common causes to troubleshoot, and then work your way to, calling maintenance, broken valves, not maintained, etc. Okay, so that was high temperature. Let's talk about low temperature sterilization. So these are going to be used for obviously items that are heat or moisture sensitive. So putting something like that in your high temperature steam sterilizer would destroy it or melt it or, something like that. So these three, ethylene oxide, hydrogen peroxide, gas plasma, and ozone are all considered low temperature sterilizers. So when I talk to you about those chemicals that could be really harmful, ETO is one of them, okay? Ethylene oxide is super effective, but it has toxic gases and very flammable, very long times. So it's not as efficient essentially as if we're talking about steam sterilizers, but sometimes it has to be used for those heat sensitive items. Now this hydrogen peroxide gas plasma can also be called H2O2, which is its chemical name, or a commercial brand name for that machine is called the SteriRad. So don't get SteriRad and SteriRis confused. Steris is parasitic acid. Hydrogen peroxide is SteriRad. So this one does work a little bit quicker than the ETO, so that's beneficial. Some facilities might prefer that over the ETO. Ozone I wouldn't say it's as common. I don't think any facility I've worked at has had the ozone sterilizer. But it is unique in that it does not require an aeration time, but the ozone gases can be toxic. So I said I'd talk to you about these biological indicators. These are important, okay? These are the only way to guarantee sterility has been achieved in any sterilizer. whether it's high temperature, low temperature, it doesn't matter, okay? They have to be they're required to be run um, sometimes for each cycle, depending on the machine, or daily, at least daily minimum, okay? So I put a picture here of what some of those might look like. This is just one brand here. They come in like a little vial of those, and inside are literally spores of this particular bacteria. This one is Geobacillus stearothermophilus. Isn't that a fun word? So that is actually used in multiple sterad, ozone, um, in your low temperature, but also in the steam sterilizer for your high temperature, okay? And then your ETO uses Bacillus atrophius, right? So those might be certification test questions as well. So if you have any questions, please reach out. You guys are doing a great job at reaching out and, saying, I don't understand this assignment. Can you please explain it? I'm happy to do that. So make sure that you reach out. Otherwise, I just assume you know what you're doing. Okay, I can only help you if you reach out to me. So here's my email. I do have office hours today, or if that doesn't work, we could try to work in another time for you if that's needed. All right. So we're at week 4. You're halfway through. Keep up the good work. You guys are doing a great job. So reach out if you need me. Have a great week.